Hi, my name's Whitney Rogers. I'm a doctor of physical therapy with a specialization in pelvic health. And today I'd like to talk to you about pelvic floor contraction or a Kegel exercise. So your pelvic floor muscles are the muscles of your pelvic bowl that line the bottom of that bowl. They start at the front by your pubic bone and they sling all the way back to the tailbone, and then they span between either sit bone. These muscles, when they contract, are responsible for squeezing around the openings of the pelvic floor. So that's squeezing around the urethra, the vagina, and the anus in order to hold back urine or stool or gas. These muscles also work to support our pelvic organs and lift them upwards, and they work as part of the core system, so as part of your core stability, and work together with your abdominal muscles. So in order to work these muscles effectively, one way to work on a contraction is actually to work with your breath. So your pelvic floor muscles work together with the movement of your diaphragm. So as we inhale and take a deep belly breath, your abdomen expands and your pelvic floor drops or lengthens. And as you exhale, your diaphragm comes back up to resting and your pelvic floor comes back up and into its resting position. So we can use this exhalation to work together with that lift of the pelvic floor and then ask those muscles to lift and squeeze together with them. So I have Therese here with me, and she's going to help me demonstrate how to perform a pelvic floor muscle contraction while lying on your back. So when you're practicing this movement, it helps to have your body fully supported so that you can be fully relaxed and really only focus on the muscles that you want to isolate. So Therese has a pillow under her head and a small pillow under her knees, so she feels comfortable and supported. So Therese, start by putting your hands on your belly. And having your hands on your belly helps focus on where you want to focus on the breath when you're taking your deep belly breaths. So start by taking a deep belly breath and allowing your hands to rise as you breathe, and your hands return to resting as you exhale. And again, now think about your pelvic floor muscles. So think about the area between your sit bones or the area between your pubic bone and your tailbone. And as you inhale, release and expand that area. And then as you exhale, I want you to think about contracting around your pelvic floor like you're trying to stop the flow of urine. So exhale, squeeze, inhale, release. And take a few rest breaths in between. So taking rest breaths allows you to fully reset and relax the muscles between contractions. Now on your next inhale, expand your belly. And as you exhale, contract the muscles between your sit bones like you're trying to stop the flow of urine. And inhale, relax. And again, just take a few rest breaths to reset those muscles and allow them to fully relax. So another strategy to enhance your pelvic floor muscle contraction with your deep breathing is by blowing out air like you're blowing through a straw. And by doing this, you add a little bit of resistance to the exhale, and your abdomen and your pelvic floor have to work a little bit harder to help the air exit. So Therese, I'm going to have you take another deep breath in, expand, and as you exhale, blow like you're blowing through a straw. Excellent. And then again, take a deep breath, expand your belly and pelvic floor. Exhale like you're blowing through a straw. And now contract your pelvic floor like you're trying to lift your perineum up and in. Keep breathing. Take another breath and relax. Great. And a few rest breaths in between. When you're doing this pursed lip breathing, you like to take a few normal breaths so that you don't get lightheaded. Another deep breath in. Blow like you're blowing through a straw. Now contract your pelvic floor as if you're trying to stop the flow of urine. Keep breathing, squeeze, and then inhale, release. Excellent. Great job.